How do you keep your A1C levels below 6.5? Well, in this video, I'm going to share with you the 4 evidence-based steps that can have a meaningful impact. You see, if you have diabetes or you have pre-diabetes, you probably already know the importance of checking your blood glucose regularly. And aside from regular blood sugar tests, your doctor may recommend getting an A1C test a few times a year. So what is A1C test? What does it actually mean? Well, I want you to think of A1C test as a report card of how well your body has been managing your blood glucose over the past 2 to 3 months. So A1C test is different from regular blood sugar test, your fasting blood glucose or your random blood glucose. A1C test measure the amount of glucose that are bound to hemoglobin, which is a protein in your red blood cells. So A1C test is going to measure the amount of sugar that is bound to this protein over the past 2 to 3 months. So this gives you a much clearer picture of how well your diabetes or your pre-diabetes is under control. Now, in general, the diabetes guideline typically advocates keeping your A1C levels below 7%. But if you can maintain tighter control and keep it below 6.5, that is even much better. So today in this video, I'm going to give you the 4 steps that you should follow to keep your A1C levels below 6.5. The first thing I usually recommend for anyone trying to bring their A1C level below 6.5 is understanding how different things impact their blood glucose. Now, this makes you more proactive rather than reactive. When it comes to blood sugar management, there are over 20 things that can impact your blood glucose level. So it is very important that we pay close attention to these things and learn from what they are. Now, most time we tend to focus more on carb, which we are going to get into in seconds. So we tend to focus more on carbohydrate while ignoring other things that also matters. How well do you track things like your stress, dehydration, your sleep quality, your temperature, caffeine, as well as blue light exposure? All of this can have surprising impact on your blood glucose level. And things like this, for example, like stress can increase your cortisol, which is a hormone that can increase blood glucose level even if you are not eating. If your cortisol level is very high, you might wake up in the morning and then if you measure your blood glucose level, you are going to see that your blood glucose level is very high. Now, dehydration can also make your blood glucose become more concentrated, making it difficult for insulin to do its job. And yes, caffeine, on the other hand, can raise blood sugar level in some people. Exposure to blue light, your phone, from your home appliances can also increase your blood glucose. So the question is, how well do you track all of these things? All of this can have surprising impact on your blood glucose. So my point here is understanding and analyzing your number regularly and also paying attention to patterns. Doing this can help you pinpoint those things that are making impact on your blood glucose and how you can avoid them. So it is very important to pay attention to all of those things that can also impact your blood glucose. But diet, like your carb, is one of the main contributors. So it is very simple. Going on a low carb can help lower your A1C level. And that is because when you are on a low carb, the amount of glucose that is going to be sticking to your hemoglobin are also going to be reduced. So that is going to help bring your A1C level down. It's going to help lower it to normal. Now, aside from carbohydrate, you also have to learn a way to outsmart your carbohydrate. You have to learn a way to eat carbohydrate without having spike in your blood glucose. And I really have a video on that. I'm going to put the playlist down below, so make sure to check it out. Okay, outsmarting your carbohydrate, learning how to eat your carbohydrate is going to help lower your diabetes HbA1C. The second step is to try and exercise. It is one of the most effective tools for lowering your A1C. I know of someone who has been doing exercise, just aerobic exercise, and his A1C level has massively dropped. Aerobic exercise like brisk walking, cycling, swimming, or even jogging can lower your A1C level with an average of 0.3 to 0.6 percent points. So the American Diabetes Association often recommend that those with diabetes should aim for at least 150 minutes of intense moderate exercise per week to improve their glycemic control. And you can really achieve this by engaging for at least 30 minutes of exercise every day, just 5 times in a week. You can get this 150 minutes of exercise, which is recommended by the American Diabetes Association. Now, in one study, individuals with type 2 diabetes who adhered to a higher frequency of exercise exhibited a more glycemic control compared to those who exercise less frequently. Now, this study also found that pairing aerobic exercise with resistance training or with strength training also helps lower A1C level. Now, in another study of 251 people with diabetes, now this study found that those who participated in aerobic activity as well as strength training for 6 months, their A1C level dropped by nearly 1%. Which is a reduction that is big enough to reduce the risk of diabetes-related microvascular complication by 35%. So, engaging in physical activity is very helpful in lowering your A1C level. So, if your A1C level was 7.5, that takes it back to 6.5. Okay? Now, there are possible mechanisms why exercise helps lower your A1C. It helps improve your insulin sensitivity by reducing insulin resistance. It helps promote glucose uptake during and after the activity. And it also helps improve cardiovascular markers like your blood pressure. It helps lower triglyceride. It helps lower cholesterol. So this combination of these benefits can indirectly help improve your glycemic control. So engaging in physical activity is going to help you in lowering your A1C level. Now the third step is time-restricted eating. Time-restricted eating is a form of intermittent fasting where you limit your eating to a set window of time during the day. So for example, you might be eating for 8 hours during the day, like you might eat from 10 a.m. to 6 p.m. while you fast for the remaining 16 hours. Now, studies have shown that in one study that was published in Diabetes Care, this study found that diabetes patients who follow this protocol of eating, who follow this pattern of eating, have their A1C level drops by 0.6% in just 12 weeks. So, which means that this strategy could really be simple, but yet it is very effective. So, what I want you to know is that you don't have to rush this strategy, you don't have to rush this step. What you have to do is to start with 11 hours of eating windows, which means that from 8 a.m. to 7 p.m. you are going to be eating. So I want you to do this for 2 weeks. Now after 2 weeks, you are going to be eating for 10 hours window, which means you are going to be eating 9 a.m. to 7 p.m. And you are going to do this for 1 week before getting into 8 hours of eating windows. Okay, when you get to 8 hours, you're going to be eating from 10 a.m. to 6 p.m. And the reason why I tailor at this time for you is because it is during this time your insulin are very sensitive, they are very active. Your body can handle carb much better during this time. So make sure to always avoid late night snacking after this time. And aside from that, be mindful of the food you are eating. Avoid food with high glycemic index. So doing all of this is going to help lower your A1C levels. And lastly is regularly monitor and make adjustments in your habits. This is very important. Keeping track of all of those things that work and those that do not work can be very helpful in lowering your A1C level. How well is your medication working? How well is your insulin working? What are these foods that are spiking up your blood glucose? You have to monitor all of these things. Your stress level, you have to monitor all of them regularly. It is very, very important. So doing all of these things is going to help keep your A1C level, is going to help keep it in normal range. Okay, so if you are trying to lower your A1C level, I would really recommend you follow these 4 meaningful steps which I share with you in this video. Alright, now if you want to learn how to eat carbohydrate without having spike in your blood glucose, check out this video.